I had the pleasure of meeting Mingming, who's a female Shih Tzu, in October of 2021. She came to the Schwartzman AMC for collapsing. We did some blood work and found that she was severely anemic, meaning her red blood cell count was low. She was then transferred to the internal medicine service to try to find out why she was so anemic. We did an abdominal ultrasound that showed a bleeding intestinal mass, which was likely the cause of her blood loss. Mingming's red blood cell count was so low that she was in need of a blood transfusion. However, when we tested her blood to the blood donor units that we had in hospital, none of them were a match. This can happen, but it's a bit unusual, so we had a feeling that Mingming could be a very rare blood type called Dal-negative. We needed to get Mingming to surgery so that her intestinal mass could be removed. However, she needed blood to be stable for surgery. The only place that we could have her blood tested for this rare blood type was up at Cornell in Ithaca. So Mingming's owner, without hesitation, brought up a sample of Mingming's blood to Cornell and had it tested, and she was in fact Dal-negative. She brought back some Dal-negative blood donor units so that we could test it to make sure that it's compatible to Mingming. Unfortunately, the blood donor units were still incompatible to Mingming, so we had to make a difficult decision. Do we send Mingming to surgery without any available blood, or do we take some time to keep looking and delay surgery? Mingming's owner made the difficult decision to send her to surgery without any available blood to give her. Mingming did amazing in surgery. She made it through and the intestinal mass was removed without any complications, and she recovered beautifully. And she did well for a few months until she developed an autoimmune condition called IMHA, which is when the body's immune system attacks the red blood cells. Luckily, we were able to diagnose and treat the IMHA before she was in need of a blood transfusion again, and she has been doing great for the past 2 years. The most amazing part of Mingming's story happened just a few months ago. Another dog in the hospital, Tammy Terrell, was severely anemic and in need of a blood transfusion. Like Mingming, she was incompatible to all of the units in the hospital, so we had a suspicion that she could be Dal-negative too. We had Mingming come in so that we could test Mingming's blood to Tammy Terrell to see if they were a match, and sure enough, they were. So after 1 week of searching for blood for Tammy Terrell, Mingming was the first match that we found. So Mingming's owner made the courageous decision to have Mingming donate blood to Tammy Terrell, which is not without risk to Mingming. Since Mingming is so small, even donating a small amount of blood can put her at risk. Additionally, if anything went wrong and Mingming then became in need of blood, we didn't have any compatible units to give Mingming. Despite these risks, Mingming still donated blood and helped get Tammy Terrell out of the hospital. So in my opinion, Mingming is not only a living legend, but a true hero. It's my pleasure to present the 2024 Living Legends Award to Mingming.